And there is cell breast examination, the easiest way to catch a breast lump early and treat it. Now, cancer breast treatments have gone so long way that no lady in the world and even in India should be afraid of a cancer breast. It is the one of the best prognosis. It is a very, I should say, good cancer to have if the lady has, because it is entirely treatable, curable, and it gives a normal life, full normal life to the lady. 99% of all cases of cervical cancer is linked to a virus that is called human papilloma virus. There are 8 to 10 different serotypes of the virus. For example, COVID had Omicron, Delta, different variants. So similar different serotypes of this virus. And this virus teaches us that, first of all, it's a virus causing cancer, and it stays in our system in a woman's vagina or a lower urinary tract. It stays for over 5 to 10 years. So it gives us a lot of ample of time before it turns cancerous. There is a vaccine available against for this virus, which is nothing new. It's not like a COVID vaccine. You need not be scared of the side effects.
Hello, Dr. Arpit. How are you?
Very nice. Thank you for inviting me to this
Nee,
podcast.
Actually, thank you for giving us time. Why have you chosen the field you are in right now? And we'll talk about every exciting episodes of all the mixture of information you have in your life. Let's go with it. Yeah.
So I'm Dr. Arpit Bhansal. I'm very thankful to be here and sharing some information with the lovely audience we have here online with us. So I'm a laparoscopic and a cancer surgeon by profession. So my parents were both doctors. My father is from Punjab side, but he's settled in Allahabad, which is a small city.
Okay.
So seeing my parents in those times saving so many lives, I always wanted to help people. That was my main goal in life. So, and none better than helping is by treating them and saving their lives medically. And in those time, I used to see so many patients touching my father's feet, and literally patients used to believe that doctors are gods. So things have changed a little bit because of social media, because of so much in Google information, and a lot of lawsuits are now happening against doctors. So that doctors have lost that kind of respect in this world. But still, as doctors, we should do our best to save our people, because anyways we have done the Hippocrates oath, which we must not do more harm. That is more important in this generation. So my journey, I when I was 6-7 years old, I started going to the OT with my father. I was not scared of blood at all, because I used to see surgeries every now and then.
You never used to feel any blood and so much of katna and everything.
I didn't used to.
You were
actually
comfortable.
no. Obviously, maybe the first times I may have been a little scared, but because it became a regular affair and seeing my father saving lives, so it motivated me a lot of by helping and by literally saving a lot of seeing patients' lives being saved from literal their deathbeds by my father. They motivated me to become a doctor and a surgeon, and then I did advanced laparoscopy. So I was being young and I was always into adapting technology. So that is why I delved into laparoscopy and then cancer and advanced laparoscopy. I've also been thinking future forward. I've been trained in robotic colorectal surgeries also from UK. So I'm already robotic surgery ready. But being based in Allahabad, obviously India has now started having good robotic surgery centers as well. But
where are these centers now?
Even Bombay, Delhi, all these places, there are robotic
Mostly
surgeries.
metropolitan
Mostly
cities.
metropolitan. The smaller places are still coming up with these centers.
Dheere
Robotic
it will
surgery is a little expensive thing for country because the basic cost of surgery increases. So being in 2-tier, 3-tier cities, robotics is a little difficult to begin with because the cost of the surgery increases for the patient as well.
Right.
Laser is again a new technology which keeps on, it's an emerging field. So these days advanced diode laser have come, and I'm treating a lot of common diseases like piles and varicose veins with laser with beautiful results, with amalgamation of different techniques, also the newer techniques.
Oh, wow.
And I'm also running the hospital, which is 200-bedded multi-speciality hospital, NABH recognized, one of the latest with all the equipments and with all the other facilities, all the other
In
departments
Allahabad.
in Allahabad,
Okay.
with my mother, of course. So that is my professional journey, and I've done my schooling from Allahabad, then Delhi, DPS RK-Puram, then I did my
Oh,
MBBS
okay,
from Bombay, DY Patil.
Okay.
So then I did my MS from Nagpur, advanced laparoscopy training with Dr. Sailesh Puntambikar in Pune, who's one of the pioneers in pelvic gynae and in laparoscopy cancer surgeries. Then I did my cancer advanced fellowship from Gujarat Cancer Research Institute.
Okay.
And then I even went to UK, as I told, for one month fellowship in robotics. And then I went to the Pioneer Institute in Laparoscopy in France, IRCAD. That is
Oh,
the
really?
Pioneer Institute
Wow.
of Laparoscopy. I've done a diploma in advanced laparoscopy there also. See, learning is a thing which, and in any field we are, whether it is surgery or whether it is so many other things which I'll tell you about in the coming hour. So we always should be open to learning.
Yeah. And with so much of learning, what was one? I mean, I see all the aspirants now that they are going for different sort of fellowships and all the other courses which are available. So, what could be one thing you would like to tell them? Like, we'll touch on this topic, what message you have for them, but that one thing, like, it just becomes like a burden for them because
See,
there's
so
so many.
as you very interesting question, and very, because on my Instagram also a lot of young MBBS aspirants and PG aspirants
Yeah.
are following me. They keep messaging me also. So I try and help and guide personally also whenever possible. But sometimes due to my occupied schedule, I am not able to help everybody. But I try and read all the messages and try and connect to all of them. So the one advice is like, first of all, be persistent and don't do this for money. Do this for your own passion. See, if you want to earn money, and people have this old generation thought कि डॉक्टर इंजीनियर बन जाएंगे तो जिंदगी में पैसा का कोई प्रॉब्लम नहीं है.
Right.
बट आजकल के लिए पैसा कमाना इज अ वेरी इजी जॉब. मतलब डेफिनेटली इज नॉट अ इजी जॉब, बट देर आर सो मेनी बेटर ऑप्शंस. यू कैन बिकम अ सोशल मीडिया स्टार एंड अर्न मच मोर मनी देन बीइंग अ डॉक्टर. So first of all, don't do it for money. And if you're going it, then do it because find your passion. Which aspect of being a doctor are you interested in? And so for this thing, I am in Rotary also. Rotary, you must be knowing, is a big organization which helps people do
Yeah.
social work.
Rotary,
Rotary
yes, yes, yes.
International.
Acha.
So
So it's international
it's the
also.
international. It's the biggest.
Because we have it in your
Yeah.
as
So
well.
it's a Rotary is the biggest international organization which
Acha.
does social welfare. So I'm the disease prevention and treatment chairman of Allahabad, Prayagraj, my district in
Acha.
Rotary.
Okay.
So in that, one of my fellow president in Rotaries in clubs, she organized a beautiful vocational training program. And I keep giving lectures in my city about cervical cancer vaccine awareness and different kinds of awareness programs for children, and different awareness programs for even general public. So I had given a talk on cervical cancer vaccine awareness in a YMCA school in Allahabad, Prayagraj. So those children who are in 12th class, they were asked what they want to do. And then through connections through Rotary, like myself, whoever wanted, so there were 7-8 children in that class who wanted to become doctors. There were some children who wanted to become lawyers. There were some children who wanted. So that or this program, we helped them do an observership under me for 15 to 20 days. In 12th class. So they observed my life. I interacted with them, and they were this was a beautiful learning and teaching experience, both for me and for them, I'm sure, because they saw a life of a surgeon who has been 15 years in his practice, and what a life of a surgeon, and also a social media content maker, because I'm running a healthcare awareness channel, and that is a need of the hour. Because so last 7 to 10 years in Allahabad, in Prayagraj, being a small city, I was disheartened many times seeing my patients. So they were most different kinds of extreme. Like in my routine practice, being a cancer surgeon, a lot of, for example, I'm giving you breast lump patients come to me. Young people and old people, young girls and old ladies as well. So breast cancer is one of the most common cancers in women in our country and even abroad. So breast cancer, the awareness is, the extremities is both sides. For example, if a lady has breast lump, so these things need to be taught to our future generation, especially the young generation, that the breast lumps can be both benign and cancerous. And the benign, like the fibroadenomas, are very, very common in the middle 20 to 30 age group of girls, even 35, 40. So I've seen regularly in my practice, girls between the age of 20, 30, they have a breast lump. But they create so much stress in their families because of misguidance of a local doctor or whatever. And the stress is the major issue in their family. Nobody in their family is sleeping. The stress is causing stress gastritis to their father, mother, their sisters, everybody. Because and just a fibroadenoma, which is, if detected early, it is a treatable
Lack of knowledge.
lack of knowledge. And there is an other, so basically she has a fibroadenoma, but she's extremely worried that it might be cancerous. So that's causing all the stress to herself and to her entire family.
But she's not taking advice from doctor to
So-
make it like
so actually the problem,
biopsy kar le and
so
then
that's what the level of misguidance and level of education and level of guidance is very, very poor in our country, especially in a lower third tier city like Allahabad. So वो homeopathy and Ayurvedic, they go and मतलब they whatever the
I
misguidance.
don't think so. It's just cities like Allahabad, but
Even
in metropolitan
yeah,
cities as
all
well.
across, even all across.
थोड़ा सा एक diagnosis हो जाता
तो
है
इससे
where
कितना पीस हो जाता है ना, पीस ऑफ माइंड. आई एम गिविंग यू अ लाइव एग्जांपल ऑफ अ पेशेंट विद अ CA breast who were diagnosed 2 years back. The lady had a breast lump 2 years back. She had the biopsies at 2 small places and there the reports were negative. And then somebody guided them कि आप टाटा में चल के दिखा दो. तो then the Tata people did a official biopsy and it came cancerous. But because she thought कि 2 local hospital में नहीं आया था, टाटा ने नकली रिपोर्ट बना दी and they thought कि कैंसर तो है नहीं. And then he sat home doing whatever treatment, I don't know wherever. And 2 years later he comes to me कि सर अब हमको ठीक कर दीजिए. So I told him कि you had a report of cancer 2 years back. What did you do in those 2 years? तो ही सेड नहीं वो तो टाटा वालों ने तो गलत रिपोर्ट बना दी थी, हमने 2 जगह और भी कराया तो वहाँ तो कैंसर नहीं था. टाटा में गए तो उन्होंने जबरदस्ती पकड़ के कैंसर बना दिया रिपोर्ट.
but then how was this it was about the I think test ka problem.
See, biopsies are proper scientific tests and should be done by experts, not just small places. If you do a small places, there is higher chances of false negative, false reports in smaller places. So, choti jagah karaya hoga,
And
usme
that's what
negative.
happened.
That's what happened in this case. But he believed in smaller places than he believed in Tata. So that's what the information I want to spread. Little bit and basic awareness people should have it on their own कि अगर breast lump है तो what are the simple signs which can help you guide and make a mind कि fibroadenoma is a mobile lump first of all and it is painless. Again, cancerous is a fixed lump. The lady cannot move it. So these are some basic difference which we can educate the general public, especially our young children, because they are more prone to it. And there is self-breast examination, the easiest way to catch a breast lump early and treat it. Now cancer breast treatments have gone so long way that no lady in the world and even in India should be afraid of a cancer breast. It is one of the best prognosis. It is a very, I should say, good cancer to have if the lady has, because it is entirely treatable, curable, and it gives a normal life, full normal life to the lady.
Yeah.
So we have gone way high in research and technology to be afraid of cancer in general at the moment.
It's not needed.
The stress around it is the bigger issue. And so now since we've talked about cancer, let me explain in basic for our audience what is cancer.
Yes.
So
before we come on to the cancer, as we were talking about that young generation needs to have a little bit about.
So for that, I started this healthcare awareness channel,
Yes.
and I try and make simple 1-minute reels, informative and educative content, so that people can get treated and basic what to do at home, how not to take stress in various issues. Just for example, summer dehydration is a big issue. How much water to drink, how to avoid
Yeah.
UTIs,
And
how
we
to
are
avoid
going to come,
piles.
because that is a very important topic and a very interesting
So you decide whether you want to start with cancer first or hydration first.
I think we should go for cancer first and then we'll go with hydration as cause, and then uska treatment will.
Tick.
So young generations can go on to Dr. Arpit's channel and get all the information required for their life, and also NEET aspirants and whoever are pursuing MBBS, I think your channel would benefit them with their studies as well.
Yeah.
So anyone can go and check out his channel, and you'll find all the information out there. And as well, like people who are choosing their career, as we were talking about. So I think India should have such internship for around 1 month or maybe like 15 days, 20, just to before getting into MBBS or
So
before.
like I announce it on this podcast that anybody who's interested I would be happy to give a free 15-day internship under me just to experience the life of
just to experience how hospital
how
works,
hospital or a surgeon works.
different specialties.
Obviously, I'll not be able to accommodate everybody, but
The doctors,
space out. If anybody is interested, they can DM me or you or on your channel. Then we can try and connect.
We'll link your channel and all the links
Correct.
wherever you are approachable, and people can go and see for themselves. This is a very beautiful approach, actually. People should know
Because I
simple
always believe in
knowledge.
collaborative approach, and we should share our knowledge. This knowledge, matlab, whatever I know, if I can impart, especially to the young generation, though the younger generation is the future of our country.
Yes. And younger generation needs proper guidance.
Correct.
That's what I feel.
That's very
Because there
important.
are so many people giving all sort of information,
Mhm.
but the authentic information is very rare.
Yeah, that's what the main reason behind this channel was.
Yeah. And what our intention is, bringing out all the information from authentic certified specialists like you, and who has deep research about their field, so that they can guide young generation, new generation, now generation, anyone. So yes, so that is done now. Let's talk about the cancer.
See,
Yes.
so what is cancer? We have cancer cells in all our bodies. Everybody has cancer cells.
Yes.
Cancer cells are basically, there is something called a cellular.
And please, could you tell people not to get alarmed by this?
So that's what this podcast is about. That to uh, let go of your fear about cancer, because cancer treatment has come a long way, and there is no reason to be scared of the word cancer and the disease cancer as well.
And we all have cells, so it's
So we are all,
manageable.
see, there is a natural process of apoptosis. Apoptosis is a cellular process which destroys the unwanted cells in our body. And anywhere, this due to mutation, due to our epigenetics, epigenomics, which are environmental factors and genetic factors, some mutation can happen, and those apoptosis cells can become defective. So the cells which need to be destroyed and thrown out of the body, they don't get destroyed, and they keep on multiplying. For example, let's talk about liver. There is some cells in the liver which the apoptosis or the natural destructive cycle of the human body gets spoiled due to any of the genetic changes, environmental toxins, so many toxins, and it keeps on multiplying. So the cells multiply at an uncontrollable rate, and then it becomes a tumor. Tumor is a growth in the liver. And for example, we are talking about liver. So then through the blood stream, it can spread anywhere. That is basically cancer to different parts of the body. So cancer, if caught early, is very, very treatable, curable. There are different stages of cancer. So this is basically cancer, when uncontrollable growth of cells happen in any organ, and it can spread to basic any other organs of the body. So first thing, there are 4 stages of cancer. This I'll just tell in briefly. So stage normal, that is normal knowledge, is stage 1 is the first stage, stage 4 is the last stage. So stage 1 and 2 are the stages where the cancer is limited to the organ which is the main organ. For example, uterine cancer, it is limited to uterus and the surrounding structure, stage 1 and 2. Stage 3 is usually local involvement. Surrounding, for example, in CA uterus, it is spread to the nearby surrounding areas. That's stage 3. That I'm just telling in general. Stage 4 is the distant metastasis. It's called the last stage, where it has, for example, a uterus cancer is spreading to the lungs is stage 4, spreading to the brain is stage 4. So when there are 2 cancerous cells in 2 very, very different parts of the body, it is stage 4.
Okay.
So the key treatment to cancer is catching it early. That is the key treatment. But nowadays, all stages are curable and treatable. Especially stages 1 to 3 is entirely treatable and curable for most of the cancers. Stage 4 is still very difficult, and sometimes it is not curable. Many times actually. So actually there are so many technologies, and people need to be aware of their body so that they don't let the disease reach at stage 4. And it is definitely a lot of stupidity on our parts, our patients' parts, if we are letting the patients reach the stage 4 with so many hospitals, big and small, across the country. So all people, all hospitals, all small doctors, MBBS doctors should be trained to not let the disease reach the stage 4 if the proper guidance has been given to the patient at the right time. Then we talk about cancer. Why is catching cancer so difficult? Because cancer is painless. Usually, for example, let's come back to the example we were talking about liver. The cancer cells will keep on growing, and it won't cause any pain until unless it presses against the surrounding organs or the nerves.
Not even any symptoms?
No, the usual signs of symptoms of cancer is loss of appetite, loss of weight, then loss of overall weight loss, mild fever, mild weakness. So these things happen in so many other diseases. Even TB happens, which is so much common diseases. So the basic symptoms are just weakness, fatigue, low appetite, low loss of weight. So, but if these things are happening, which is a very common thing, which happens to most of us, just so many nutritional deficiencies can cause these things, magnesium deficiency, which people ignore, and so many other things. So these things can be caught early if we are aware of our bodies.
Yeah,
So
and I think time to time proper health checkup.
Proper, that I was coming to. So in India again, nobody follows up a routine protocol. In US and UK, the incidences of cancer, the prognosis of cancer is getting better day by day, because there is an annual, for example, annual mammography for over the age of 40 years, which is never followed in India. Even educated, it's not followed by affluent people. Forget about the unaffluent and the uneducated poor people. And same goes for pap smear. The human papilloma virus is it's a virus which is responsible. So the two most common cancers in ladies is the breast cancer and the cervical cancer, and both of them are very, very easily preventable, treatable, catchable. Breast cancer is cell breast examination is the best way for all the ladies, and any doubtful lump should be immediately addressed by a doctor or educating yourself a little bit. Then cervical cancer is 99% of all cases of cervical cancer is linked to a virus that is called human papilloma virus. There are 8 to 10 different serotypes of the virus. Like for example, COVID had Omicron, Delta, different variants. So similar different serotypes of this virus. And this virus teaches us that, first of all, it's a virus causing cancer, and it stays in our system in a women's vagina or a women's lower urinary tract. It stays for over 5 to 10 years. So it gives us a lot of ample of time before it turns cancerous. And as I'm again stressing out, it is a 99% cause of cervical cancer is this virus. And there is a vaccine available again for this virus, which is nothing new. It's not like a COVID vaccine. You need not be scared of the side effects. This vaccine is available in the market since 40 years. And my mother, who is a gynecologist, she's been using it in Allahabad, in a small city of Prayagraj, since 25-30 years. My staff, who is 25-30 years, they got the vaccination done in 2000, which is
wow.
And one more myth about this HPV. So what is human papilloma virus? Human papilloma virus is a sexually transmitted virus, and it is like a very, very widely common virus everywhere. And most HPV infections in women and men both will not cause anything, will not cause any disease, no cancer, no dysplasia, nothing. So it will just die off automatically, a natural death. Most will not cause anything, but some will cause cancer. So we still need to be aware about it.
Not every.
So human papilloma virus is so widely common, like TB, that so many people have it. But if we have doing the annual pap smear test, and now there are HPV tests directly which detects the virus, then there are ways to treat it at an early stage. Just the virus infestation, we need not let the virus grow in our bodies.
Right.
Then again, best thing is, so this vaccine is best delivered when given between the age of 9 to 15 years, when the girl or the boy, and again, I'll come to it again, it is a gender neutral vaccine. Even I have gotten it done. It's not a vaccine for ladies. It's not a vaccine for women or girls. It's a gender neutral vaccine. And so between 9 to 15 years, when the girl or the boy has not been sexually active, that is the best time to give this vaccine. So before starting his or her sexual part of the journey, if the vaccine is given, then it is almost 95-99% effective against this virus. You can protect against this cancer, which is the only cause of this cancer, the virus.
So this information, as you said, it's gender neutral. It is very rare that people think, okay, there's only the vaccine is only for women's. And actually, there's a very interesting story behind this vaccine. So we were in our MBBS, and there was a gynec HOD. So she used to teach us, and she used to always make sure that girls, did you get the virus? And that was I felt that was a very good initiative from teachers.
Did you get the vaccine or the virus?
Like, you are in the hospital, why aren't you guys getting?
The
She used
vaccine.
to first ask us that, have you got the vaccine? And we used to be like, no ma'am, do we really need to? She's like, it's the stupidest question you guys can ask.
Yeah, definitely.
Go get right
As
now.
MBBS students, if
And yes,
if you won't get, then whom should
yes.
the
And
we expect to get it.
she was like, you guys are becoming doctors and you guys need to go and
And as
get the
as I was telling,
vaccine.
this is a very, very old vaccine. Now newer companies are coming. That's
Yes.
a different story. But so this HPV vaccine is can be given up to 45 years legally in FD
Acha.
approved.
Okay.
But in India, outside India, it is being given to up to 60 years, 70 years, because now the lifespan is increasing. Like people are staying more years, healthy lifestyle. So this vaccine is equally effective if given towards the later part of our 40s, 50s, 60s also.
Acha.
But the best way to is to do it before 15 years, and if you take it after 15 years, it requires 3 doses. It efficacy reduces as late we take, but still it is very effective up to 30, 40, 50 years, over 90, 85% effective. So
And what are the cycles of these vaccine?
the dose, so 0 months, 1 month, and 6 months.
Okay.
I have myself taken this vaccine last year only.
And guys can also take
Guys
it.
should also take it because
Wow, this
human
is like-
papilloma virus is a sexually transmitted virus which happens in men as well. And many types of penile cancers, anal cancers, some kinds of throat cancers are also caused due to this virus. So it can not only protect you from cervical cancer, but also other intimate areas for women like vaginal cancer, as I already mentioned, some kinds of throat and anal cancers as well. So it is protective against all those cancers and some other diseases like vaginal warts, perineal warts for men also, which can be prevented by this vaccine, which is directly caused due to this virus.
This, I think people now please go and get the vaccine done, and it is available in
It is everywhere.
everywhere.
Every good gynecological or good hospitals. Yeah.
Okay. As you are practicing since long time, what all diseases you come across in your daily life? What would you like to tell people about it? What are some common diseases you come across?
See, first of all, so here I would like to go a little in deep. Most of our issues are related to our gut health. Our gut health is our primary health. Just to tell everybody that from our mouth to our anal area where we pass our motions, there are trillions of good bacteria in our body, trillions of good bacteria in our gut, in different parts of our oral cavity, nasal cavity, and vaginal cavity, the vaginal gut flora, different floras.
Right.
So these trillions of good bacteria, they are like a organ, like a system of our body, and they work in harmony with our body, with our cells. And we consume a lot of bad bacteria through our diet, through our air, through our environment, so many things. And if you have a good population of our good
Gut
bacteria,
bacteria.
so basically it's a community which is living in harmony with ourselves, in our cells. And if we have this good bacteria, we won't get any diseases. So how are these good bacteria? Ideally, we should be consuming them through our diet. If you go to our traditional diet, traditional not only Indian diet, but even South Indian diet, even maybe Japanese diet, maybe even Chinese diet. And
What are some very good diet for healthy and good bacteria cultivation?
see, all kinds, largely part of our diet, healthy diet should be a plant-based diet with good fruits and vegetables, with a lot of fermented foods. Like, for example, South India has a lot of fermented food. And even our North Indian culture
And I
has...
think dhokla and all those.
Yeah, all these are fermented foods as well. So all parts of our country have different kinds of fermented foods, like kanji also in Maharashtra, and different kinds of Northeast. They have in Northeast also there are different varieties of kimchi salads, and even Asian cuisines have a lot of kimchis and a lot of different kinds of
Any food that gives you
good
probiotics and prebiotics.
So the vaster the biodiversity of the good flora in our body and the numbers, the healthier we will be. That's the basic goal of maintaining a good healthy gut microbiome. So there is a good biodiversity of healthy gut flow, good bacteria in our body, and the vaster the biodiversity, the different kinds of good bacteria, the healthier we will be. And obviously in terms of numbers also of those bacteria. So any diseases related to a gut, piles is the most common one.
Really?
Piles is the most common. People deal with constipation, diarrhea, and IBS. All these things are directly related to what we are consuming, and also to the hydration levels, which we will talk a little bit later about hydration. But piles, basically, what are the root cause of piles? What exactly is piles? Piles, in our near our anal verge, there are some valves which has normal blood vessels in good numbers all across the anal verge.
Right.
And due to constipation, which is the major lifestyle issue of this generation, because people are doing shifting to the westernization diet, western diet, and consuming less fiber rich food, and more animal based, meat based diets have more constipation or gut issues. So the ideal diet, I'm not saying be a vegetarian, but I'm just saying it should be a largely plant based diet. For taking your proteins, depending on your choice, you may eat a little bit of non-vegetarian, but in non-vegetarian, fish is the most healthy, and we should limit the red meat as much as possible. Plus, we should limit the dairy intake, because these days healthy organic milk is also not possible, not consumed anywhere. A lot of all the milk we consume usually is through a lot of mixtures with steroids, pumped up, and so even the farming, a lot of pesticides. So organic, why is everything shifting back to organic? Because of this, because we need to eat as natural as possible and as seasonal as possible as well. Now everybody sitting in Bombay, we would want to have a diet based of maybe Korean diet. So we should try and avoid this. Actually, we should try and eat more local and more natural, and also of the season. Like this, because of cold storage, every fruit is available in all the seasons, every vegetable is available all the season. If you follow the nature will guide you automatically. In summers you should eat more fruits like watermelon, loki, and all those fruits which are water based and which grow in summers. In monsoon you should eat fruits like which grow in monsoon. In winters you should eat more green leafy vegetables which grow in winters. So,
and I have understood this fact.
And wherever you are will make it different. Like if you are in Bombay, it will be different. If you are in Dehradun or if you're in the hills, it will be different. So, so you should eat local and organic to be the most healthy. We are not talking about whether non-veg or if that's up to your own choice. And little bit of fish is this is very healthy for our diet. So if we maintain our nutrition in proper ways, then we don't need an pre or probiotic supplementation. But most of us do these times because we are not consuming the enough fiber intake and the good bacteria which we need. So, and being a medical practitioner since 12-15 years now, when you come to talk about history of any patient, most of the chronic issues, apart from the directly labeled gut issues, are linked to our gut. Our headaches, our anxiety, sleep issues, immunity issues, chronic joint pains. Most of our chronic issues, if you dive deeply into the patient's history and lifestyle, you'll come to know it is related to his or her gut.
And that's what causes piles and everything.
So piles, if you talk about it, is caused because of chronic constipation, which is again due to lack of fiber and lack of water.
Is it also because of genes?
Not piles is not directly cause of genes. We'll go to the genomic part a little later about the gut health. I'll tell about aging. In that I'll tell about the gut health aging. But piles, there is two things. One thing is constipation is the root cause, so we should have to avoid constipation by drinking more water and eating more fibrous, hydrated fruits and vegetables. The second and the most common thing leading to piles in this younger and the older generation is people spending too much time in their toilet, reading WhatsApp messages, reading newspapers, and people spend half an hour on that's and they feel pretty normal about it. It's a very, very wrong practice, because during our anal verge there are two sphincters, the internal sphincter and the external sphincter. The external sphincter is voluntary, we control it and we strain it when we are passing motions, but the internal sphincter is involuntary. And if we sit on the pot for maybe half an hour, so our brain is constantly thinking that we are sitting on a pot. So the internal sphincter is constantly under the strain. So it is ultimately chronically going to cause you issues related to gut, including piles. And these days, because of stress gastritis, the gut issues are increasing rapidly. And a lot of anxiety issues again related to gut. So as I was telling, a lot of cognitive issues again related to gut because of so much improper diet. And this brings us to hydration now. So hydration is a very, very important part. And when we talk about hydration, especially in this heat, now Bombay is having rain, so it's good. But back in my city, Allahabad, it is still pretty hot. And still rains haven't come. So dehydration, heat stroke, we are seeing a lot of number of patients of heat stroke this time. Because of the global warming, I was telling, we have been encroaching nature, destroying oceans. And
basically, before, like when you are thirsty, you're already so dehydrated that you need to actually get yourself a really good amount of water.
Correct.
Before you
So the
are
So the go-to is that you should drink water, carry your own water bottle and keep sipping water all throughout the day. So your goal has to be, you should never ever feel thirsty in your life. That should be your goal. Never ever feel thirsty. Forget the feeling of thirst. Try to forget the feeling of thirst. If you can do this, you have mastered your hydration levels.
And how can a person like randomly drink? But then isn't actually, I also wanted to know, sometimes people do over drink water. And
So we'll come to that.
what are the healthy and
So things. One thing is, again, we try and not feel thirsty, and that depends, varies on your activity level. If you're working out, your hydration level requirements will be different.
right?
If you are in a heat environment, and your hydration level will be different. In a winters, your hydration requirement will be different. So that things varies. If you're on medications, your hydration requirements will be different. So that is different. But the second, so coming to your question, so the second most thing is to monitor our hydration levels by monitoring our urine color. We should all that's the best hydration gauge system which God has given us. So we should try and keep our urine color as clear as possible, very very lightish shade of yellow, which doesn't look yellow on first appearance. That should be our goal. It shouldn't. So overhydration is only possible if you keep gulping water, if you keep sipping water all throughout the day and having little water without feeling thirsty, then usually you will not go towards overhydration, and you will come to know if you're passing crystal clear water urine, then obviously you might be going to overhydration. But overhydration is not a thing to worry about in a long term, if you think, because very less people are overhydrated. 99% people are underhydrated or cellularly dehydrated. So let's focus on that.
Okay.
Because as I was telling you, so for example, we are constantly living, like we are office goers, doctors, engineers. So we, in our lifestyle, we are adapted. Human body is so beautifully adaptable that if you are consuming on a basis 80% of water which we need, we will function normally. Our cognitive brilliance will at 80% is brilliant. Our physical body will perform very good at 80%. Our immune system, everything will fight everything. But imagine the DNA repair mechanism is also only performing 80% of its capacity. So that there was research done on this, and it proves that cellular dehydration is one of the leading causes of cancer. Because
Really?
yeah, because of our DNA repair mechanism which is there in our system.
Baapre.
But our cells are living in a chronic state of dehydration. They are not able to perform that optimally as we are made to perform. So then chronic diseases, lifestyle diseases like hypertension is directly caused because of a chronic state of cellular dehydration. These are all scientifically proven things. And so imagine, just water can save you from cancer if you are, but we have to bring that level of awareness in ourselves.